Hi, everybody. I'm Celine Moran. I'm joining you from CDI and the Childhood Development Initiative. We're based in Tala in Dublin. And I suppose I just wanted to talk to you today about a research project that we've done on dads. And it's called Being Dad, and it's capturing fathers' voices on the hopes and struggles of fatherhood. I suppose we really kind of we've been trying to work with dads and engage and involve dads for the last few years in CDI, because we know, as I'm sure you all do, there's a large body of evidence now telling us that involved and engaged dads really have better outcomes for children's, for mothers, for fathers, for the whole family. So we really wanted to capture their voices. I suppose before I moved on to look at the research in detail, I suppose I just had put up these two quotes from Bowlby and from the Circle of Security Group. Some of you are familiar with them. They're a parenting intervention in the US. I suppose they're both based on that notion, Winnicott's notion of there's no such thing as the baby, it's the baby and the other. So I suppose it was just for us to kind of think about that, how we value our children. And to do this, we must cherish their parents. And I suppose really just to kind of pose that question, because I suppose fathers have been kind of really not captured in a lot of the parenting research. So it's I suppose that's what we wanted to do, to show dads that we cherish them. We wanted to hear their voices and then listen to them and hear what they're telling us. So I suppose the objective of our research was, because I suppose we know there has been kind of, I suppose, a lot of expectations around fatherhood have really shifted significantly in recent decades. But what we wanted to do in our research was to really give voice to those dads. We were looking at Tala-based dads, where our project is based, and to really place them as experts in recounting their own experiences, to get them to, in those discussions, to help identify and highlight what were the structural or psychosocial barriers, to help us really understand what's the barriers for them in terms of becoming involved with their children. And really, I suppose, leading ultimately to better outcomes for children, mothers, fathers, and really the whole family. Just to kind of give some background to that then, just to give some context to the research, I suppose, as I kind of said earlier, there has been a dramatic kind of shift in our expectations of fathers in recent decades. And fatherhood is probably considered a really textualized experience, because the social discourse is very still pervasive on the traditional role of the male as breadwinner and female women more in caregiving roles. But yet we know that there is a large body of evidence which really shows what a positive impact it is for children when dads are more involved in their life. There's also quite a lot of research looking at health and well-being benefits for mothers when fathers are included in maternity care. This looks at a whole range of things, from smoking, to a whole range of things. And then we also know about lower parenting stress and depression when dads are more involved. And obviously their role there is in buffering a lot of stress. But then, a systemic review which took place by the Fatherhood Institute and Yale University really shows us that fathers are really not included in any research about parenting interventions, and that really there is a scarcity of research on their views and experiences. So we chose, I suppose, a qualitative framework, as we felt it really offered the opportunity to gain more in-depth insights into the experiences of the dads who participated. So we're really looking for the nuances. We had originally planned, I suppose, to run this project as a focus group, but it coincided with the pandemic. So obviously, like a lot of things, we had to kind of change and adapt to that. So we would have used a convenient sample, and we recruited this through our own databases in CDI. We also have a very large database through our Dolly Library initiative. We also recruited through local men's groups, such as Shamrock Rovers, which is a very large soccer group. So we would have really worked locally with the community to recruit men. So we actually had a really excellent response. We had over 25 dads get in touch, say that they wanted to be involved, but we ended up working with 11 dads in total. So the interviews would have been in-depth interviews. I conducted them one-to-one, lasting 60 to 90 minutes. Most of them would have been conducted through Zoom, a few of them face-to-face. And then we also looked at gathering some socioeconomic data on the dads. So the dads who participated, they would have completed a socio-demographic questionnaire, you and your family, which would look at, I suppose, the demographic profile. And what we found was the dads who participated were generally reflective of the wider Tallaght area where we work, which I suppose maybe like similar to lots of areas is characterised by broad-ranging contrasts of relative prosperity, but then also distinct pockets of disadvantage and deprivation. So in total, we had 11 dads, and the average age of the dads was 37. And between them, they had 16 children, ranging in age from 3 months to 13 years. But the majority of the children were of the younger age group, in the 0 to 4 age group. And I suppose this really kind of points to that golden window of opportunity we have when children are young to really engage and involve the dads. 73% of the dads identified as Irish, a very large number in full-time education, in full-time employment, and a high level of third level education. A large number of the mothers were also full-time employed, and I'll come back to this kind of point because it's quite relevant as well. And we had just a small number then identifying as a single parent. So the interviews would have been recorded, transcribed, with overarching themes and sub-themes emerging. And we would have used a thematic analysis then to draw out the themes. So the three major themes to emerge were embracing fatherhood, a desire for greater equality in caregiving, and seeking a parity of esteem in relation to encounters with healthcare professionals. So just to talk a little bit more on these overarching themes. The embracing fatherhood, this kind of really related to the emotional impact of becoming a father, challenges that it entails. And then a lot of the dads would really expressed a very strong desire to be equal caregivers of their children. And then also the challenge of parity of esteem in interactions with healthcare professionals. Looking in greater detail then at just embracing fatherhood, and I suppose the sub-themes that kind of emerged within this. The transition to fatherhood, I suppose, is well known to be a time of a very profound change. It's very similar to motherhood, a time of very profound change, more so than any other developmental stage in a man's life. And I suppose the narratives from the dads really was reflective of this intense and complex nature of the transition. The dads would have described become a father as a very positive, rewarding, enriching experience, really describing their children in very loving terms. And you could see them visually lighting up when describing their children. But I suppose anxiety and worry did also emerge as a significant theme. The dads would have talked about concerns about their children, future financial aspects. Some dads were concerned that they weren't, bonding immediately with their children and felt it was difficult to get support for their emotional impact. And we'll come on to that. So I've included a few quotes there from the dads who participated. So I suppose one of the dads just kind of remarking that it was, amazing experiences, difficulties, but the good sides outweighing the bad sides. And then just in relation to the anxious nature of it, and the kind of transformative nature of it, just simple things like driving, that I'm more careful about how I drive. Then in terms of life changing, dads would have spoken about, I suppose, that those huge adjustments being made changes to their sense of identity, relationships, social lives, and being a dad would have often been described as being an overwhelming experience. Their own experiences of being parented was also, I suppose, very influential. And I suppose this is something that we know from parenting, regardless of what information one experience is actually very influential. And I suppose common among the dads was that desire to break away from the traditional way they were parented. So moving on now, just to look at that great desire for greater quality. And I suppose the themes that came up here was that difficulty of balancing work and family life. I mean, some of the dads, depending on the work circumstance, were able to take time off, really have a better work-life balance. They spoke about enjoying spending time with their children, to bond with them, engage deeply. And they also kind of talked a lot about being, I suppose, a role model for their children. Lack of support for dads was also came up as a significant theme. This was both in terms of formal and informal supports. There was a sense for lots of the dads that it was difficult for them to access supports. Some dads felt that there weren't any supports available. Others spoke about not feeling welcome at support groups and being the only dad there. They seem to struggle. Some dads also seem to struggle in accessing informal supports from peers or families. So you can see there's a quote that I've put up there. I don't know if it's men or me, but I wouldn't talk to any of my friends about this. My wife turns to this big group. So I suppose there's kind of two issues, I suppose, that can be there. Is one, that maybe there isn't supports for men, but then also that maybe they're struggling to reach out as well, which I suppose is something that is known within men's health. Another significant thing that emerged was this notion that the mother somehow becomes the gatekeeper of conduit of information on parenting. And I suppose many of the dads that I worked with spoke about their partners really knowing more than they did about babies and how the baby develops. And whilst some of the dads kind of said, initially they would have set out, they would, know the same amount as the mom, that as the baby grew, it felt as if all the information was kind of being channeled through the mom. And obviously this has a lot of implications then for the mom becoming overburdened, but also the sense that the dads felt that they were kind of powerless. They felt a lot of the information was geared more towards mothers, and that they really were not developing their own capacity as a parent and tending to defer to the moms as the experts. So just wanted to move on now just to talk about encounters with healthcare professionals. And I suppose this was a theme that came across very much as well in the research. And I suppose, as we know, the early years, that 0 to 3 time, is the time when families really come most into contact with healthcare professionals. And I suppose a common theme that also emerged, is that dads, understand and accept that maternity care is very necessarily, based and centered on women and babies. But I suppose what we found is that the experience for dads of attending maternity hospitals was mixed. There was some very positive experiences, but other dads felt very involved and confused by what their role was. And I suppose when we looked at the dads and this information, they all would have interacted, I suppose, with maternity hospitals over the same time. So it couldn't be explained by changes in practices over time, but just, I suppose, inconsistencies with the approach and what they were met with. So as I said, some dads talked about really good experiences. The staff really welcomed me, included me. They felt very well taken care of. But then other dads felt that they weren't really allowed to ask questions. Some of them talked about their family history not being looked for. So there was this sense that, that they didn't feel that involved for some of them. Just want to talk then for a minute as well about community-based healthcare professionals, and I suppose the dads would have talked here about GPs or public health nurses. And again, it was similar. So there was kind of very disparate views and experiences. Again, a very mixed bag. Some really positive experiences. That the public health nurse was really good. Came in, helped me, showed me how to change nappies. Did a lot. Really kind of helped me to give a first bath. So there was an awful lot of really positive experiences, but also then there was some negative experiences. Some dads really felt they weren't sure what the role of the public health nurse was, and they weren't acknowledged, they weren't spoken to in the house, and they really felt, I suppose, invisible. And I suppose for one dad, this really became difficult because when the whole area of maternal anxiety and postnatal depression was raised, that they felt that they weren't able to access healthcare professionals because they didn't know them. And I suppose at a time when maybe the mother wasn't in a position themselves to seek out or get support. So just moving on then to look at the findings that we came to from the report. I suppose the dads really who participated were very attentive, concerned, interested, wanted to be involved in their children. And I suppose with the nature of this research, the dads put themselves forward. So that is what you would expect. But yet for many dads, they were aware of the role of fathers. A lot of them didn't have dads that were involved and they wanted to be that different type of dad. Yet it felt that there was this gap or chasm between what they wanted, the type of dad they wanted to be, and how they actually transition and how they actually become more involved with their children. I suppose what we saw is, that need for or that lack of a structured father-inclusive approach across healthcare professionals, and that this is maybe leaving dads confused about a role and how they can support their partners. Dads often felt that they were navigating the role alone, and that they were floundering, and really there isn't enough information for them there on the transition to fatherhood. So I suppose to look at really the recommendations that have come out of report would be really to look at a systematic approach to engaging with fathers, really involving and including them from the beginning, and really supporting and preparing fathers for the reality and challenges of pregnancy, labour and parenthood, and what their role is and how that would benefit the whole family. And I suppose really what we found, or what we're saying, is that fathers really cannot support their partners unless they're also supported, included and prepared. So fathers as well need information that's specifically naming them. We found that when we spoke to them, that they felt they weren't specifically named in any of the literature. And that when parents are named, they would tend to kind of defer to the mothers and not think that information was for them. I suppose we're also recommending like formal and informal supports and interventions for new and expecting dads, and really kind of involving fathers in this, talking to them, listening to what they feel they need, and look then really at how we can move the discourse on to promote really more equality, because women are become overburdened with the information as well. And really then, I suppose, to look for more research on fathers. There is very little data looking at Irish dads, and even obviously the maternity experience that I've watched the presentation beforehand. There's really no information on dads captured in that maternity experience survey, even though the one in Northern Ireland does capture some information. So I think really to try and capture more information on dads would really be good. So I suppose moving on then, and what the next steps are, I suppose what we have been working on coming out of the research is trying to obtain some funding to work with the group of dads now to kind of co-produce and co-develop resources specifically for dads. So it's very much a doing with the dads, rather than a doing doing too. And as I said, kind of really then advocating for changing some of the resources which would currently say mother and or partner, just to add, and we don't want partner to be removed, but just to say father and or mother's partner, just that we are specifically naming dads. I suppose we're also calling for structured father or inclusion and engagement training with healthcare professionals, such as nursing and GPs and across the board, and really looking to work with professional bodies and groups to look at a whole team approach to developing practice with fathers. So this is something that we will be working with, also developing workshops for student nurses and midwives on how to engage and work with fathers, and developing a toolkit around that, and then working with some of the governing bodies to maybe have some of that training CPD credited, or how we can work on developing that. So that's really the end of my presentation. So thank you very much. Have a full report is available on our website. I just have the details on the next slide, which is going to come up to you. We also have printed copies available, which I can gladly send out to anybody. And obviously we are working with a lot of groups now to disseminate the information. So thank you very much for listening.